traditional orthodontics has been messing up faces for 50 years. It breaks my heart to see all the people that are struggling to sleep and breathe. And just because you're asleep when it happens doesn't mean it's not fucking horrible for you. The system is absolutely broken and doing everything wrong. And we have to look at how we're helping people develop their faces and their jaws so that we can change this epidemic and get people sleeping and breathing again, and also get our beautiful faces back.
Good morning, Hilary.
Good morning.
This is the earliest podcast I've ever filmed. So we're doing this before 8 a.m. So you have a lot of places to be in the next 24 hours. You got Del Bigtree, Alice Clark, then back home to Bozeman, Montana, which you are not just Hilary, you are Dr. Hilary Fritsch. And you've been a dentist for 20 years, right? Mm-hmm. And you're not just like a dentist, you're like a really cool specialized dentist. And I think the field of dentistry that you're in, because of my wife, which is how we know each other, the field of dentistry that she's involved in, I think is the most revolutionary form of dentistry. And I'm here with you, so I can ask all the questions I hear her talk about, but I'm trying to understand it because I have clients ask me about the airway journey with my kids. And then I get responses from them like, oh, well, I think my kid's fine. Or don't worry, like we're just going to get braces, you know. And I'm a product of braces. And I know based off of what I understand about millimeter width, I'm slightly above average, but I'm not where I should be. And so the couple of things I want to like, hopefully you can like clarify for me and anyone listening is like, what's airway dentistry? What should our jaws be? And why the fuck does that matter? And then are parents putting their heart in the right place of getting braces, but they're in the wrong system for their kids? Like all the things they think they're doing good could be doing harm. And this is a lot to unpack in about like 45 minutes. So good thing you have your coffee ready in hand. I'm gonna put this on you. Put the cape on you. I probably keep the coffee underneath unless you want.
I'll keep it underneath.
Unless you want hair fibers in your
little keratin in my.
I do not believe it's a good source of protein, nor just because they're called hair fibers and it's a good soluble or insoluble form of fiber. I think it would just be disgusting.
Yeah, let's keep it out.
All right, good.
I want to follow your lead on that. Well, where do I start? Let's see. One thing that I find all the time is families that think that they can just go to the regular orthodontist as well. And basically, we're in an airway epidemic because no one is developing the jaws that they're meant to have anymore, which means literally everyone. I mean, in the last 2 years of my practice, I saw 2 kids maybe that had a well-developed palate and airway.
Really?
Yeah, 2.
Just 2.
Just 2.
And then and like out of the patient pool, like what? Like how many is that? Like, I mean,
thousands of people, and I saw 2 kids.
Okay, so that's like not even like a percent. That's like 0.0 something.
Yes, okay. It's not even a percent for sure. And their mother is a nutritionist, and she's like an awakened nutritionist. You know, she fed them on Weston Price diet, breastfed them as long as she could. And
by the way, Weston Price is like, I don't know if he was as valued when he was alive.
Yeah.
But like most things, I feel like you give it enough distance and people go, you know what? Maybe the guy was more right than wrong.
Yeah, I kind of wonder how he was perceived by his colleagues at the time as well.
I just know that like along with him, Charles Darwin was also noticing this with the aristocratic families and the royalty. Mm-hmm. Because they had access to what, Hilary?
Soft foods. Yeah, I feel like that was the beginning of the end. Actually, been doing some homework on that because there was a really tight relationship between the American Medical Association and like Gerber. So they basically came to all the doctors and said, hey, we want you to help educate these mothers so the babies don't choke and they should be eating everything pureed. And corporate America pushed an agenda that put us in the pickle that we're in, because when you chew hard foods, you develop the muscles, and when you develop the muscles, you develop the jaw. And so when we give everything to babies pureed, or even if it has a crunch like those puffs, but then it melts in their mouth, we're doing them a massive disservice to jaw development.
So puffs are bad.
Yeah, I say puffs are like cigarettes for babies. They're terrible. Not only are the ingredients horrible, but the fact that they just melt means no jaw development.
Yeah, I mean, we did baby lid weaning.
Yeah.
And I still think even with that, like from what I understand is that even if you do all the quote things, like you breastfeed for longer than 6 months, like you do it for a long period of time, you don't bottle feed, you don't do the pacifier, and you give them more solid foods, they're already born like in the negative because the jaw thing it's not evolutionary, is it? Or is it evolutionary?
Well, there's epigenetic changes since baby formula came out. So
Okay.
if anyone in your bloodline didn't breastfeed, there'll be epigenetic changes. And almost everyone has someone, in their past now, because we're 7 generations from the baby formula coming out.
And it only takes like what, one generation?
One generation can cause epigenetic changes. So I have a lot of mothers who come into the office. We have really crunchy practice, and they are like, we've done everything right. How did this happen still?
That was us.
Yeah. So, I mean, basically, I don't think anyone should just go to the orthodontist and get their teeth straightened without looking at airway. I think that's wrong. It's unethical. It shouldn't be done.
So like when parents, like then I'll have to sit in my chair and go like, oh no, he's fine or she's fine. Like, their mouth is closed. Like they sleep with, they're not mouth breathing. They're fine. What would you tell like a parent who says that their child's fine? And you look at that individual, like there's so many clients. I don't want to say patients because you're talking about patients. You have patients, I have clients. That's how the difference is between hairdressers and doctors. Is
Yeah.
Doctors have patients. We have clients. And I look at their teeth and I see the clouding. I know they've had braces or they have veneers, right?
Yeah.
And then they smile and they have these big triangles on the corner.
Dark buckle corridors.
That thing. Yeah. And then they're like, no, my child's fine.
Yeah.
And all I keep thinking about is like, all right, you're just talking about how you're using mouth tape to like get better sleep, right? You're telling me that like you're thinking about doing a sleep study and that like your doctor has maybe mentioned that you might have a minor case of sleep apnea. Like I know that you're doing, either veneers, some sort of like orthodontics treatments where it's about restricted, about aligning the teeth to look pretty but not functional. That's what I
That's a great description.
determined. They look great, but
Yeah.
it's not fun. It's like when you go to those museums and they have like the car put back together, but it doesn't run. It's like,
Yeah.
oh, it looks great. That's a beautiful 1969 Camaro Yanko, but does it fucking run?
Yeah.
No. It's just there for the looks. All show, no go. And how do you get through, or can you get through to adults who clearly they would have benefited from early airway orthodontic intervention, and they have an opportunity to give their children one of the biggest gifts, which is health, which I think every adult, every parent hopefully wants their kids to have better health than they did.
Yeah.
How did you get through to them?
It's tough because people don't want to admit that their kid mouth breathes.
Okay.
So I start with any parting of the lips counts as mouth breathing.
Oh.
Because so many parents are like, no, my kid's great. My kid's not mouth breathing, because they feel like it's an offensive thing to say. So I try to kind of combat that with my story, because I've been a mouth breather my whole life. So I'm not judging, what I want to do is help everybody. And if you do orthodontics without looking at airway, there's a very good chance you're going to make the problem worse, or make their airway worse and make it harder for them to breathe and make less tongue space. So I don't care if the teeth are straight in the front. If they don't have teeth from corner to corner when you smile and they have black triangles in the corner, that's too narrow.
Okay. So that's too narrow.
Yeah. So to me, when you say it looks really beautiful, I don't think it looks really beautiful to have it just where all you can see are the front 6 teeth.
I don't think people really understand that, like, you're supposed to see all the teeth.
Yeah.
I think people think like, oh, look, my teeth are straight.
They think it's straight.
They're straight and they glow bright white.
Yeah.
As long as they glow in the dark, like, you know, David Schwimmer's character in Friends, and they're straight, then you are good.
Well, I think that they're probably looking in the mirror thinking, I don't love this, but I don't know what's wrong. You know, because we haven't been talking about palatal width enough for people to identify that.
How did you become enlightened to this?
Well, because I wanted to fix myself and my kids.
What do you mean fix yourself?
So I come from a family where my grandmother was taught that only poor people breastfeed. And
by the way, I don't think she was alone on that.
No,
there was a huge stigma about that. Like, oh, you can't afford baby formula?
Yeah.
Poor people. The poors and the poors and their. Funny enough, you go to like third world countries and like really remote villages, they have mean past dental and airway. It's insane. It's the thing that I've always, anytime I've watched National Geographic, I'm like, look, there's these people and oops, sorry, alarm. I'm like, and anytime I see these National Geographic, I'm like, okay, cool. They're living in huts. They don't have electronics and they have perfect fucking teeth.
Yeah.
Their teeth are bright white, big smiles, no cavities. What the fuck?
It's modern diets.
Do the Amish have a modern diet? I'm curious. Has anybody like, does the Amish, or where did they fall in? Because I feel like they're like the weird connecting dot.
Yeah,
perhaps
that's a good
like
question.
Remote rural villages and then living in a Western world.
Yeah, I do have one Amish patient actually with a really recessed jaw who's doing orthodontics with me now. But her son was in the other day and he looks amazing. So I think she might have, you know, had some issue that came up that made her not be able to nasal breathe. So people need to understand the tongue is the architect of the face. And if you can't nasal breathe, you're screwed. Whoa. You need to be nasal breathing all day and all night.
That's hard. Because I don't think I ever nasal breathe. I always thought that like when people talked about like you're supposed to breathe through your nose, I'm like, what are they fucking talking about? I can't even like breathe because my nose was so congested as a kid.
Yeah, same. I was getting allergy shots.
What?
As a kid because my congestion was so bad. And we were kind of like barking up the wrong tree with that.
What were some, okay, so you were trying to figure out like help yourself. You were doing like self-help dental version.
Yeah.
Did you know it was dental related when you were trying to quote fix yourself? Did you know that this was all dental related, or was this one of those things where you kind of like how did you realize
evolved,
it?
You know, I didn't know it because we were taught nothing about airway, palatal growth, jaw development, tongue space. Not one sentence was uttered in dental school about that. So I didn't put the pieces together. Yeah, that's a big problem. And that's one of the reasons why we're in such a pickle right now, because when the traditional academic mainstream program doesn't discuss it, then it makes it seem like quackery when you do want to help people with airway, you know?
Do people say this is quackery?
Yeah, I just put a reel out critiquing the American Academy of Orthodontists or American Association of Orthodontists, because they put out a white paper very recently, basically trying to shield themselves from liability because they haven't looked at airway for 50 years and they're not only not looking at it, they're harming people by ignoring it, pulling teeth and doing retractive orthodontics. And I said, this is cover your ass dentistry. Like you can't, the whole reason that they wrote this white paper was to protect themselves and shield themselves from having to do airway. And they tried to say that there's no evidence to prove that airway dentistry improves sleep and breathing and that you need an MD to give you a diagnosis of sleep disorder breathing before you can treat it, which is just honestly all bullshit. They said a CVCT doesn't give you information about the airway reliably.
Even though it's like literally 3D rendering of your whatever.
Yeah, it's a 3D rendering of your airway, your nose, your sinuses, your tongue space. It's the most valuable piece of information that I get when we evaluate patients. So for them to say that is really upsetting. But that is basically the system that we're pushing up against. So people like me, I feel like a rebel. I get side eye from my entire profession because I'm trying to help people breathe better.
But what you're talking about isn't crazy, because there's like a book that's very mainstream called Breathe by James
Nestor.
Yeah. I mean, he was on Theo Vaughn and they're talking about it. And it's like, this isn't like a crazy topic. And like, I don't understand why it's not like it feels like it's the last ditch effort by the mainstream dental thing to like do like the emperor has no clothes kind of a thing. Like they're doing anything they can to just kind of like discredit. And I said this on another podcast. I believe that like when people start to like character assassinate or attack the character of like what people are doing versus actually what they are doing, that's like the first giveaway that they're doing a straw man argument.
Yeah.
Would you agree?
Yeah, I totally agree. And you have to steel yourself against that if you're going to be in this field, because people are trying to attack your character.
What's the percentage of dentists that, because we were talking about this when I was blow drying your hair earlier, there are dentists, which treat adults and pediatric dentists, right? You have orthodontics, which that's, you know, we always classically think of them as braces. You have oral surgeons, which, you know, they're doing all sorts of shit, you know, surgically. You have biological dentistry, and then you have airway dentistry. And the biologic dentistry and airway dentistry are not actually connected, but they could be. And you are both of those. So what's the percentage that you have somebody who's a biologic dentist, like in dentistry? Like what's the percent? Do you know the percent, the number?
Like people that claim to be biological, it might be something like 5%
Okay.
at this
And
point.
airway?
Airway is less than 1%.
All right. So you're like totally in like the minority group.
Yeah. So there's just a problem in dentistry right now where a lot of people claim that they're biological, or they claim that they are airway, and they maybe have taken a course or two, but they don't really know the depths of either field. But true airway dentists who know how to do it, it's way less than 1%. I mean, there's so few of us. It's rarefied air. And the problem is because there's so few people that know how to actually do it. So in order to get trained on it, you really have to get lucky to find the right people. And that was Tooth Pillow for me, actually. Michelle from Tooth Pillow helped me find Kevin Goals.
Okay.
So prior to that, I had spent like 8 years and hundreds of thousands of dollars on CE training to try and figure out this airway stuff, and nobody knew what the hell they were doing. Yeah.
And that's where you got in with Kevin and Tooth Pillow, which is...
Yeah.
And Tooth Pillow is how do you describe it? Like, what's that system?
Tooth Pillow is a company that was born out of an access issue. Because there are so few of us airway dentists, basically people realized we need to get airway dentistry to more people, and we could turn this into a corporate model by creating a platform where patients can find an airway dentist and get treated remotely and get sent appliances through like remote care. So basically, right now it's for children. You send in photos, a questionnaire. An airway dentist in your state will evaluate the case, decide what kind of appliance you need, and mail it to you. And we use a variety of different appliances for different bites that help ensure a nasal breathing habit, get the tongue down the roof of the mouth, help kids get their tongue and their lips stronger, which is essential to a nasal breathing habit. And when the tongue's on the roof of the mouth, it helps grow the face. So it basically assists in expansion, aligning the bite, and getting the teeth in the right place.
It's so funny to me because when I hear about like the beauty impacts, you know, of that sort of thing.
Yeah.
I wouldn't think that the industry of dentistry would be against this. I thought the biggest pushback would be the filler injector plastic surgery group, because if you do that, you won't need fillers for cheekbones. Like you'd have great cheekbones. You wouldn't need to have surgery to correct a recessed jaw. My cousin, when she was younger, she had to have insane surgery because her jaw was like really slumped back. She had to go through and get it all pulled forward and all rhinoplasty because she couldn't breathe through her nose. She had like this crazy, I think her jaw was even like wire shut out part of this way to make everything. And I just remember seeing that when I was like 12 years old, going, holy fuck, I'm glad I don't have to do that. So glad I only have to have braces. And she had braces too, but like, from what I understand now, between what my wife has talked about with, you know, working with you and these other doctors, is that like, when you're having the braces without checking the airway, not understanding how wide it is, it's like you're hugging the teeth back when you really need to let the teeth go out.
Mm-hmm.
Am I like understanding that correctly?
Yes.
What I had, like I now can't wear my retainer, but like from what I understand, it's kind of a good thing because somehow along the way my jaw was able to move.
Yeah, you were able to make more room again. Yeah, basically, traditional orthodontics doesn't take airway into consideration at all. They don't ask you, can you breathe through your nose? They don't ask you how big is the tube you're breathing through. They don't look at your sinuses. They don't. Ironically, they're critiquing us for doing too much when they're just treating cosmetics.
Okay.
Or potentially, you know, they try to say, oh, well, we're fixing the bite. But the bite's going to get jacked up again if you don't get enough room for the tongue and you don't fix the airway. Because the tongue and the airway problems win every time.
So if you were to like fix the airway, you fix the bite? Is that like how?
Yeah, absolutely.
And then the byproduct of fixing your airway and fixing your bite is that ideally your teeth are going to be more straight.
Yeah. So if we have proper airway development, we have to look at 4 things. Does the nose work? Do you have enough room for your tongue? Is the tongue strong enough to stay up and out of the airway? And how big is the airway itself? And so basically what that means for jaw development is growing forward and wide so that you get the whole maxilla and mandible up out of the airway. And then you develop enough room for the tongue. You got to picture that the mouth is the garage for the tongue. And if the garage is small, the tongue is going to hang out the back of the garage and into the airway. So if you don't take that into consideration, your garage is going to be too small and your tongue is going to impinge upon your airway. And that's what pretty much everyone has. When you take CT scans, that's what everybody looks like. They're too narrow and their tongue is hanging out the back. And so what we need to be doing is helping people grow forward and wide, because when they grow forward and wide, they also get beautiful cheekbones, beautiful lip support, and they make room for their mandible to come forward so their chin isn't trapped back.
Yeah.
And what that also does is it gets the teeth well placed so that the forces are straight up and down instead of on an angle. And it prevents clenching and grinding, because clenching and grinding 99% of the time is an airway compensation. And that's what really starts to beat teeth up. So these teeth that have been worn down are more prone to cavities, are more prone to root canals, they need crowns more often, they get gum disease more often. Pretty much all of the things that you see in dentistry that cause damage are a byproduct of airway.
So this is like the body saying, like sending out smoke signals like SOS, Morse code going like, help, help, help. And everyone's like these people are like, don't understand Morse code anymore. They're like, it's an ancient language. Like, I'm sorry, I don't know. I don't know this. Fuck it. We're just going to do this. We're not going to decode the like the ancient way of talking across transatlantic thing was like Morse code, right?
Yeah.
And the way reason I say transatlantic is because that was of the time period of Weston Price and Charles Darwin. So this is like of a time when those things were probably looked at and taken more seriously. Like, people have never heard of Weston Price. Everyone knows who the fuck Charles Darwin is.
Yeah.
And like, so if they're like, oh, I don't know Weston Price, you could be like, well, do you believe Charles Darwin? They go, absolutely. Well, he fucking saw it too. So it's like, how can you reconcile, like, well, I don't believe this guy, but I do like this guy. I'm now going to not believe him on this one freaking topic because it goes against everything I've been brainwashed to believe. Like, that's what it sounds like. It's like they're just sticking to something because they're too prideful to say, like, I may have been wrong.
Yeah. And I think they're like, how could this whole system be that broken? And we don't want to admit that. There's a, generation after generation after generation of dentists that were doing things wrong. Because I love my colleagues. I don't want to say that about them, but we really have lost the art of understanding airway and the downstream effects of mouth breathing. Because that was, to your point, that was known, and it got lost.
Yeah.
In fast dentistry, kind of like, we got to move these teeth. We're going to wait till they're 12. That makes it easier. You know, trying to help a kid nasal breathe is a whole project.
Yeah.
It's way easier to ignore it and just get the teeth straight. And then, you know, it'll relapse later, but we can at least say we did our job.
What are some like dead giveaways for like somebody who's like, no, we're fine. And you're like, well, here, take the, what is it? I'm going to use a quote from something I saw. Take the Pepsi challenge, right? Like, if you're so sure, then you have nothing to lose but time, which is taking some photos and submitting them for your child, right? Like I look at like, well, what do you fucking have to lose? And if you don't do the thing, that's fine. But you learn something about your child. It could be major, it could be minor. It could be like with our children, pretty substantial. Like I mean, my son's profile before and after doing tooth filler with my, you know, it's been like absolutely just like a game changer to the point where I've my clients who I have that are grandmas and grandpas, they're the ones who are like, I recognize this with my grandkids and I don't know how to have a conversation. And I'm like, I don't know how to have that conversation either because I'm not a grandparent and my kids are growing up with this. Oops, sorry. And so I'm trying to stay on track because we have a very hard stop.
We're schedule here.
We're on a schedule. This is more tight of a schedule than the salon. So I'm like, I'll be with you in 10 minutes. I know I'm a little behind. We'll be fine. But it's not today.
It can't be late for Dell.
No. You're gonna like it. It's super nice.
Yeah, I'm excited to meet him.
But yeah, the like, how do you approach that conversation? Like, how would you recommend that for somebody or even somebody who's like their child is in that treatment and they're just trying to figure out how to have that conversation with like a friend or family member about like their child, because no one wants to go, oh, by the way, I think your child's gonna grow up with a really recessed chin. They're gonna have sleep apnea. You know, those dark circles that look unsightly on your child? Yeah, they can look more attractive without them. Like, that's kind of fucked up.
Yeah, it's hard.
But the reality is like, it's like the truth hurts. Like, these things are all like visual clues.
Yeah, I mean, the thing is, you see your kid every day, so you don't even realize how much they're struggling, you know, because that's just the normal. And I think even me, like I saw my 8-year-old had space in between his baby teeth. And so I thought he was doing really well when he was 5, but he was grinding his teeth and wetting the bed a little bit and kind of restless sleeper and wouldn't wear a tooth pillow. So I put an expander in him and he stopped wetting the bed, stopped moving around at all during his sleep. He obviously wasn't grinding his teeth. He started just nasal breathing all the time naturally because his nose opened up. I mean, it's a game changer for everyone. Even the kids you don't think really need it, it's even a game changer for them. That's the wild thing.
That was like our youngest, Axel. He slept with his mouth completely closed, silent sleeper, all through the nose. But he had no space in his baby teeth. So if we were going off of like, oh, their mouth was closed, you know, we would have never done the assessment for our youngest had we not done it for our first, just because we're like, well, what's the harm? Worst case scenario, he's fine. You know, best case scenario is that. Worst case scenario, he does the same treatment that our son is in. You know? Our oldest.
I mean, the thing is, your kid's going to get orthodontics because every kid needs it.
Yeah, it's almost like this like rite of passage these days. Like, oh, they got braces. Woo.
Yeah,
they're gonna become a teenager. It's like that's what it reminds me of.
We've normalized that need for braces when if your child needs braces, they have an underdeveloped jaws. 100% of the time.
And if you had braces, you had an underdeveloped jaw. And if your parents had braces, you had an underdeveloped jaw.
Yeah.
So the likeliness that two parents who have braces that have dark circles and are testing out all the wonderful mouth tape and they're like looking to like, you know, the biohackers of the world trying to like maximize their sleep to get a high sleep score, right?
Yeah.
If you're one of those people and you have children,
you need to do airway dentistry. It's not optional.
Because you could be preventing your child from suffering what you're suffering with.
Yeah.
Why Why is that a bad thing to want to do?
I don't know. I don't understand it. I feel like the likelihood that your kid doesn't need airway intervention is like, they're more likely to get struck by lightning. Every single kid needs this help. That's why every single kid needs their wisdom teeth out, because they haven't developed their jaws enough. That's why every single kid needs orthodontics.
What about things like adenoids or tonsils? Like, how is that? Does that play in? Is that affected? Or is that a completely separate issue?
Oh, that's 100% part of it.
It is?
Yeah.
Okay. Explain.
So
Please.
adenoids and tonsils will become swollen and inflamed if you don't have a good nasal breathing habit in place, because the air is not getting filtered and cleaned, and they're having to work harder to keep all that tissue in the head and neck healthy.
So could potentially, hypothetically, not my medical advice, we're just having a conversation here.
Yeah.
Potentially, if a child has slightly larger adenoids and tonsils, not like obstructive where like no air is going through, could this airway intervention really like make them shrink?
Absolutely.
Is that how it is?
Yeah, I see that all the time. And Audrey Yoon's research showed that expansion will dramatically improve the tonsils and adenoids 95% of the time.
That's pretty awesome.
Yeah. So if it's not causing severe apnea, we do expansion first before surgery.
So this is like, I don't know, my thing has always been from learning from clients who are doctors. They said, like, look, always try all the least invasive techniques first before you have to like cut yourself open. And I thought that was like an interesting thing, because I'm like, oh, that's actually really like, that makes sense. Because I had a problem with like my shoulder or something. I'm like, do I need surgery? I'm talking to all my orthopedics, like work on the Lakers and shit like that. I'm like, do I need this? Like, nah, you're fine. They go, look, first go to a chiropractor, go to a massage, like if it still happens, get, I don't know, I think they stick the needles in you. Like acupuncture, try all of these other things. And then if it's still happening, then we're gonna do a scan and then come to my office.
Yeah.
But like, that was the advice I got. And I thought that was like it seemed like a pretty fair and like safe thing to do. Is like, what's the harm of doing the least surgical?
Yeah, I mean, I think that should be the policy across medicine. We got to take the most conservative approach unless we're in an emergent situation.
So what can adults do? Like, can adults like you who are like, hey,
Yeah, so
like,
I'll tell you my story, because it's really kind of informative to how I treat adults. Basically, I couldn't breathe through my nose my whole life. I had allergy shots. I had an expander as a kid, which everyone said, I had an expander. I'm like, well, that doesn't mean shit, because your expansion was probably minimal and you've probably relapsed since then. But I'm sure it helped, some. And then I had surgery on my nose about 10 years ago, and that relapsed because I didn't establish a nasal breathing habit afterwards. And your nose is meant to have air going through it all day and all night. If it doesn't, it's going to become congested and inflamed and like a swamp that doesn't have good water flowing through it.
Okay.
So that, without establishing that habit afterwards, this is why everybody has their sinus surgery revision done over and over and over. So what we do is structurally open the nose with a palatal expander, because the roof of the mouth is the floor of the nose. So if we widen the roof of the mouth, we can also widen the nose. And it doesn't look different on your face, but inside the nose, the volume increases and millimeters matter. So I use a non-surgical expander. It's a little retainer that comes in and out, and it pushes on the bone. And when you push on the bone, you can remodel the bone.
And you can do this as an adult?
Yeah, I have 70-year-old patients that we do it with.
Oh man, that's insane.
Yeah. And then you use clear aligners afterwards to continue to go wider, make more tongue space, line up the teeth, get the bite right. And the expander helps you grow forward and wide. So we just keep always working on forward and wide, forward and wide.
And then from there, like it's not like they have to wear this thing forever. It's not like the retainers, like everybody knows how to retainer, and they didn't get the one that was like cemented in their bottom and top jaw. You know what I'm talking about? They go, and you can see the metal.
Yeah.
None of us can wear fucking retainers anymore. Like we're like, it doesn't, it doesn't fit.
I mean, also to like put a patient in a retainer for the rest of their life feels like a bad option. We want the tongue to be the retainer.
I mean, can you imagine if like you went to the doctor and they're like, oh yeah, by the way, I know you fractured your foot, but you're gonna need this walking boot forever, just to make sure. Like that's the ridiculousness. It is. Oh
it
yeah,
is.
well, you know what? I know we did surgery. We connected some stuff, but you're gonna need this walking cast until the day you die. But that's what sorry, sorry.
You're so right. That is what it's like. And when we lock it up with a fixed retainer like that, there are downsides to that. Basically, like I'll see the whole canine to canine that's locked together shift like one big block because the teeth are still pushing in when you don't have the tongue holding that space. So everybody that needs orthodontics should also get myofunctional therapy so that their tongue is trained to hold that. Otherwise, they will relapse.
So that's like getting the personal trainer and the dietitian. You can't just do one to get like healthy. You have to do both.
That's exactly right.
Okay. I'm just trying to put,
it's like,
I'm like a fan of analogies because like they help me simplify like complicated things. Like if that, it's like, it'd be like, if you don't do myofunction, like, oh, look, I got the trainer. I'm still eating Burger King and I don't know why I'm not making the moves,
Yeah. It's like taking a really overweight person, putting them on a GLP-1 and getting them skinny and saying, now you're healthy. That's what traditional orthodontics is.
Sounds glorious. Sounds amazing.
We just make it look pretty-ish. Doesn't solve any of the root problems that cause the problem to begin with.
Got it. So like closing us, because we're wrapping up on this haircut.
Yeah.
By the way, how's the haircut feel?
I love it. It's so pretty.
You're gonna have to come back to
I'm
Austin.
definitely flying to Austin for all my haircuts.
Well, hopefully you don't have like a 9-hour layover in LA like you did yesterday.
That's not high maintenance at all.
No, not one bit. Yeah, you're not going to really be able to get good barbecue. If you were staying longer, I would have smoked ribs for us.
I wish. Yeah. Next time we'll come for a couple days. Yeah.
So closing us, like what are like the things you wish people would do, or things that you say or that you would want to say, but maybe because your platform, like I would say like, what would you say if you didn't care about blowback? Like, what would that be like? Like, what are the things that like people need to fucking hear? Because I think like that's the thing that
I think traditional orthodontics has been messing up faces for 50 years. It breaks my heart to see all the people that are struggling to sleep and breathe. And just because you're asleep when it happens doesn't mean it's not fucking horrible for you. And the system is absolutely broken and doing everything wrong. And we have to look at how we're helping people develop their faces and their jaws so that we can change this epidemic and get people sleeping and breathing again, and also get our beautiful faces back.
Yeah.
Like it's wild to walk around knowing what I know at everyone. And I feel like Santa Claus, like I know what you doing in your sleep.
Not being nice list, huh?
Yeah. And it's really too bad to see this entire population of Americans that can't breathe and sleep well. It's not like, oh, this is just happening to fat people. This is a everyone problem.
Well, there would be those stories that you'd be like, such and like Mike was so healthy. He was a marathon runner. He was in shape. Then he died of a heart attack in his sleep.
Yeah.
It's like, could that possibly have been related to like an airway issue?
Absolutely. I've seen so many phenomenal athletes that have an airway issue. This is absolutely really good triathletes, those long 100-mile runners.
Oh yeah.
Swimmers, NFL players. I mean, elite athletes with airway issues.
That's
I mean,
really
Michael
crazy.
Phelps, look at his face. You have only to take 1 second to look at his smile to know he has jaw development and airway issues.
Should he be treated?
1,000%. The fact that he was able to accomplish as much as he did.
Like, what would he have been able to do if he had right air?
Yes.
Like the best air.
Yeah.
Oh man, that's crazy to think about. That like he was able to accomplish that with like probably like a small percentage of what his maximum potential could have been.
Yeah, absolutely.
Now, my wife said that you have like this fun little thing where you like to show serial killers.
Oh yeah.
And now it's not that all serial killers, not everyone who possesses these traits are serial killers.
Right.
It's just that these serial killers all seem to possess these traits.
Yeah.
What are those traits? Because I mean, I think it's funny. I have a friend who does true crime, and she's always talking about, these people. What is it? Because I don't pay attention to this stuff.
Well, these psychos all have a mouth breather face.
Mouth breather face? What's mouth breather face?
Long and narrow. Their faces grew down instead of forward and wide because the tongue is laying on the floor of the mouth, so it's pushing actually down. And they have like hollow under their eyes and poor cheekbones and poor forward growth. And they all have that mouth breather face, which I think is coming from brain development is massively affected by poor sleep, fragmented sleep, and hypoxia in childhood.
Yeah.
So these guys, my theory is that we could have less sociopaths and psychopaths if we could treat airway.
Really?
Yeah,
that's interesting.
I just think that there's a link between these brain issues and poor sleep. And we know there's research to show. Like even when we fix the airway on kids, we can't correct for years of poor brain development.
Oh, wow. For years.
Yeah. So this is one really important reason to have your child evaluated when they're 3.
Okay. So it's like ADHD, which seems to be like the most talked about thing with children, like, such and such, like, and that, it's not ADHD. It's just they have too much screen use. And then, but like, it sounds like.
I mean, just freaking use a little logic. If your child's displaying ADHD symptoms, we got to make sure they're sleeping well.
Okay.
Because hyperactivity comes with bad sleep. So they might actually have ADHD, but they might also just have bad sleep.
All right. We are at the time to
get in the car and go.
Yeah, we gotta.
Well, that's a fun talk. You primed me nicely for
your whirlwind of
my
podcasts.
next 2 days.
I know. How do people find you? What's the best way? What's like? Do you have like a newsletter? Do you have a website? Like, what is it that people can find more and continue this conversation, or at least listen to you on this conversation?
Well, I'm on Instagram at Hilary Fritsch, DMD, where I try to share a lot of educational content. And I have a website, saddlepeakdental.com. We see patients from all around the world. Last week, I even had a patient from Dubai that we chatted through his case. And we should probably make a newsletter. Dr. Goals and I are starting to teach other dentists how to do what we do. And part of that's going to be a video newsletter where we kind of break down what we learned that week.
Oh, wow.
What's coming out in the research. But that's going to be for doctors.
What about people like me? Like, I have kids, or I have friends that have kids, and they're like, no, like, I'm okay. Like, I'm fine. I only exhibit everything. Like, like I know some people personally, I want to like just pull them aside and shake them and go, look at you. Look at the classic mouth breather. By the way, I never even heard of the term mouth breather until of Stranger Things. Because I said mouth breather. It was like a negative. So I'm almost worried if like every parent who saw Stranger Things, like my kid's not a mouth breather. They're not. They don't exhibit the definition of mouth breather from Stranger Things.
Yeah.
But it's like, bro, they're mouth breathing.
Yeah. It's like, it's this ultimate insult, but the reality is they're all mouth breathing.
And it's like not like watching them when they're also sleeping, like watching them when they're doing something like brainless. That's what I call it. Like when they're like coloring or something like that.
Yeah.
Now,
Or their lips parted when they're coloring.
What about the tongue sticking out? Does that like...
That means their tongue is like, I can't be in my mouth because I'm going to pinch off the airway. Yeah,
that's not cute. That's a medical...
That means we need forward growth badly.
I was that kid. Drawing, crayon, marker, tongue.
Yeah, because if your tongue were to sit back, it's going to pinch your airway too much and you can breathe better when it's forward.
And how is your airway journey now? Are you complete with all of it?
I'm going to keep going, actually. I finished one expander. You can finish an expander in 3 months if you wear it all the time as an adult. But I finished one and I want to keep going because I was at 30 millimeters and I'm now at 36 and I want to go to 40.
One more question. Since you can do this as an adult, what, like the other feedback I would think would be like, well, I'll just wait till they're older to do this. Why is it to do it when they're a child? And not just fix it like when they're in their 30s and 40s like us?
Well, it's just that brain development piece that we just talked about. You miss that window. You can't get it back.
Okay. So if you want like a happy sane child.
You If you want a happy, sane, healthy child, you have to look at their airway when they're 3, because if you miss that brain development window, you're not getting it back. And you also are going to change their lives in ways that you can't get back because they are tired all the time and they maybe didn't get to the athletic potential that they wanted, or they weren't doing well in math and now they think they're bad at math. There's a whole downstream effect of poor sleep. These children are spending half their lives asleep. And if they're doing it wrong, that's going to impact their entire existence.
So that's a pretty motivating reason, I think. I think that everybody would agree that that's a very noble and reasonable thing to want.
Yes, this isn't just for crunchy parents. This is, every child needs this looked at.
It's funny. Do you know, between the women and the men in my clientele, do you know which ones are most open to it?
I don't know.
The men.
Really?
Because they're all sports fanatics. And they go, wait, so my child could be better at sports? They could be better than me? It's the craziest thing that men seem to be the most open to this, because they understand this they understand that athletics is a combination of all this. And if they ever did baseball, football, track, these athletic things, they understand that this is a vital part of the VO2, which everyone's trying to, their little aura rings like, oh, my VO, sleep number shit. They seem to be the ones who are like, I want to talk to my wife about this. And then, boom, no, they stop it right in that conversation. So I'm trying to figure out, like, how is it these men are like on board and then like the mothers are like not on board?
I think they're like, well, Jimmy's whole friend group goes to Dr. So-and-so, and that's who they think there's some luxury about going to see this orthodontist who's taking care of all the kids.
Well, thank you so much. I wish we could talk longer.
Me too.
Wish we could go out for barbecue or something.
Yeah.
All right. So find you on Instagram. I'm going to put everything in the show notes.
Thank you.
And hopefully you like your haircut.
I love it. It looks great.
And we got rid of that little shelfie thing.
Yeah, it's so much better.
Awesome. All right. Thanks, guys.
Thank you.